Or under the tongue.
Or under the tongue. Okay. So now you've done a basic assessment here. You want to, hopefully your patient, Mrs. Zhivna, has been very good. She's been able to follow simple commands and answer questions and even participate in the lecture. What you want to check now is a quick neuro assessment. You can, Mrs. Zhivna, do you know where you are?
Yes, I do. I'm in Mercy Hospital.
And what's today's date?
Today is 11/21/1913.
Oh no, Mrs. Zhivna! I hope she's not your clinical instructor. No, we had to make sure you guys were awake. Okay, so you want them to know to be oriented to person, place, and time, okay, and possibly current events. You want to, can you give me a nice smile, Mrs. Zhivna? You're checking for symmetry in their smile, okay? Can you please squeeze my hands? Give me a strong grip. Good. Now can you hold your arms out just in front of you? Very good. You can put your arms down now. You want to make sure that their grips are equal and they have equal strength in their extremities. Okay.
I do my extremity.
Oh, your lower leg too?
Yeah.
Okay. Can you push? Okay, good. Okay, now can you lift your leg up and hold it? Very good.
And I can flex.
Ooh, you can flex. She's a good flexor. Okay, great. Thank you. Okay. Now let's get back to our upper neuro. I'm going to do...
And you'll do the other one.
Right, and always compare right to left. But we're going to do our perla, pupils equal, reactive to light, and accommodating.
But you're going to shut the light off in the room.
Right, you'll lower your light or pull the shade. And you go from the side, and you bring it across quickly. And you should see the pupil constrict, and then go back to normal. And you'll do it from this side, and this side. And you'll compare the two. And on some pen lights, they have the actual sizes of the diameters of the pupils. There's a little chart usually that you can find in the EMR that'll show you the sizes. All right? So we've done neuro, respiratory, neuro, strength. We need to go to the abdomen. First thing you want to do is check for bowel sounds, because you know if you palpate first, you're going to increase the number of bowel sounds. You may increase the number of bowel sounds. So you start and you listen for your bowel sounds in all 4 quadrants. Briefly, you want to check and see if that abdomen is distended, if it's soft. You want to ask the patient when the last time they moved their bowels, if they're passing gas.
That was yesterday.
Good. Oh, you moved your bowels yesterday? All right, more than I needed to know, Mrs. Jim. Okay.
And they need to listen to the bowel sounds again on skin.
On skin.
Yeah, not through the gown. And the last thing you'll do is palpation.
Right, you do palpation to see if there's any soreness, okay?
And you ask, does this hurt? Does it hurt?
Does it hurt here? Right, does it hurt here? And if there was pain, you would notify, again, your nurse and your nursing instructor. All right? So you then want to ask them if they've been going to the bathroom. Have they been micturating, urinating? Okay? Does it burn when you pee?
No, it doesn't.
Okay. Do you go frequently? Do you have to get up at night? These are all important. Do you go small, frequent amounts or large amounts? These are all important factors that are that you need to, for information you need to get.
But sometimes when I cough, I
Yes. Do you have dribbling? Do you have stress incontinence for older women? All right. So we've done the abdomen, urinary, range of motion. You want to check their legs. Make sure that with their color, that they're equal. There's no edema, pain, or swelling. You check for their popliteal pulse.
You can use both hands for the
Popliteal back here. Your post-tibial. Your dorsal pedis. Okay? And you want to compare both legs. You compare their sizes. Okay? You want to check for edema. Okay? You want to check your capillary refill. Are their toes mobile? Are they the same color? Sometimes with your patients, you'll notice that they start having discoloration in their lower legs. Mrs. Zhivna and Mrs. Bachter will be going into that further later on this semester for the causes of that. You need to make sure you check for your DVT. You do your modified Holman by just having them pull their feet back and assessing if there's any pain. Okay. One of the last things that we'd like you to do in a focused assessment, as we're back here, you also want to check the condition of their skin on their heels. Is it soft and spongy? Is it reddened? Are there any skin tears? These can be signs of skin breakdown. What you'll need to do is lower the head of your patient's bed. You don't need to make them flat, but you want the head of that bed down. You're going to ask them to roll over on their side, and you're going to assess the back of their head, their shoulders, all their bony prominences for any type of skin breakdown. If they're on bed rest especially, you want to check for any type of ulcer or skin tear. You want to note the size. It needs to be measured in millimeters. You want to note the drainage. Okay. If there is a dressing there, if it's intact, if it's saturated. And these are just basic facts for a focused head-to-toe assessment for the beginning of your semester.
And if they have an IV inserted, okay? Even if it's just an intermittent infusion device, that means they don't have an IV bag running. What you should do is put your clean gloves on and palpate with your clean gloves and ask them, when you press, do they have any pain? And look for any visible swelling. So even if they don't have IV fluids running, you still have to assess the insertion site.
Very good. And also, you never take a blood pressure if there is an IV infusing in that arm.
If they have oxygen going, okay, a nasal cannula, make sure both prongs are in their nose. Also note the liter flow on the manometer device on the wall.
This is your manometer up here. And it's universally, your manometer is green. And you'll turn this, and as you turn it, there's a little silver ball that will go up, and it'll show you where the liter flow is at.
And in the Catholic health system, the line is through the center of the bouncing ball. Okay, that's how you do your measurements.
Good luck. We'll see you soon.